Hi, my name is npurrazzo, and I am going to be doing a periphery exam. This is Tom. Tom, do you agree to have this video uploaded to Olivet and to be used in this video?
I do.
I'm going to scan the room just to make sure that there is no extra help here. And I'm also going to scan my note card in the video just to make sure that it's only 10%. Okay, first off, I'm going to start washing my hands. I'm going to use some soap and wash my hands. I'm going to introduce myself to the client. Tom, my name is Nicole. I'm a nurse. I'm going to be performing an exam on you. And we are going to start with your fingers. So I'm just going to ask if I can see your hands.
Sure.
Here, we're going to palpate and assess for any pain, swelling, redness, any tenderness, nodules in both hands. Here, we can also assess capillary rate fill. We want less than 3 seconds here. Also, we can assess for bilateral radial pulses, and they're equally bilaterally +2. Okay, next I'm just going to have you do range of motion. So I want you to go ahead and flex your hands in, which is flexion, extension, hyperextension, hands a little back. Go ahead and put your hands down. We're going to do abduction, adduction, and then we're going to do thumb opposition, which is bringing your hands up. Next, I want to test your strength, so I want you to go ahead and squeeze my fingers. Go ahead, squeeze. That's good. Both bilaterally, 5 out of 5. Next, we're going to move to the wrist. We're going to inspect and palpate the wrist. Notice for any crepitus, pain, swelling, nodules. Pain, swelling, nodules on the other arm as well. Next, we're going to assess for range of motion as well here. I'm going to have you go ahead and flex your hands down, do flexion, extension, then we're going to go up, hyperextension. Go ahead and have your fingers out. We're going to do ulnar deviation and radial deviation, and then we're going to do, just make some circles. We're going to do circumduction here. Thank you. Next, we're going to assess the elbows on each arm. We're going to go ahead and notice for any pain, tenderness, swelling, any crepitus. Same with the other arm. While we're doing this as well, we're noting any skin color, any skin deformities as well. And here, we are going to do range of motion for the elbows. So you're going to go ahead and do flexion, bring your arms up, extension, bring your arms out. Put your arms back a little bit more, hyperextension, and then we're going to go ahead and rotate your arms in, and then rotate out, in and out. Okay, next we're going to test for strength of the elbows and the biceps. So I'm going to have you flex your arms up, pull against me, pull, and then pull against. So, there you go, good. Next we are going to assess the shoulders. So we're going to also look at the skin, notice for any pain, tenderness, and swelling. Same with the other shoulder as well. Okay, good. Next we're going to do range of motion for the shoulders. So I'm going to have you go ahead and do flexion, put your arms out, extension, bring your arms up, hyperextend your arms back. Next I'm going to have you have your hands touch the back of your shoulder, which is internal rotation. Bring your arms behind and touch your back. External rotation, okay, you can bring your arms to your side. We are going to do abduction, adduction, and then go ahead and make some circles with your hands. Any pain or tenderness? Okay, you can stop. Now in the exam, we're going to notice for any pain or pauses for any portion of the range of motion. And if here, then the client can stop if they're feeling uncomfortable at any moment. Next, we are going to go ahead and do light sensitivity. So here, I'm going to touch you with a cotton swab, and we're going to touch on each side. Let me know if it feels the same on each side. You can keep your eyes open for this exam.
Yep.
Does it feel the same?
Yeah. Yes.
Put up your hands.
Yes.
Okay. Next, I want you to see if it's sharp or soft.
Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay. You can go ahead and open up your eyes. For the next test, we are going to go ahead and test for stereogenesis. So I'm going to go ahead and have you close your eyes, and we're going to put an object in each hand, have Tom identify which this is. So I'm going to go ahead and...
A pen.
Okay, and the other hand?
A key.
Perfect, thank you. I'm going to have you keep your eyes closed still, and I'm going to have you open up your hands. I'm going to draw a number. Please let me know which one it is.
1, 3.
Yes. Okay, you can go ahead and open up your eyes. Thank you. Next test we are going to do is we are going to test the vibrations. Okay, so you can keep your eyes open for this exam as well. We are going to tap the tuning fork and we're going to go on the ulnar side. We're going to tap. Do you feel that?
Yes.
Do you feel?
Yes.
Do you feel anything?
No.
Okay. Ulnar side on the other side.
Yes.
Feel it?
No. Yes. No.
Okay, perfect. After that, we are going to go ahead and do cerebellar coordination. So I'm going to have you go ahead, make a fist. Go ahead and shake them for me. Perfect. Next, I'm going to have you make the OK sign. And then I'm going to have you run your fingers back and forth. And go as fast as you can. See how you can do. Perfect. Next, I'm going to have you place your hands on your lap. And you're going to go ahead and flip-flop back and forth. Back and forth. Okay, you can stop. Next, I'm going to have you go ahead, look at me, look at my nose. I'm going to have you go ahead, touch your nose, touch my finger, touch your nose, touch my finger. Other hand, we're going to go ahead, touch your nose, touch my finger, touch your nose, touch my finger. Perfect. After that, we are going to go ahead and do deep tendon reflexes. So I'm going to use the hammer, and we're going to go on both sides. So I'm going to go ahead and do the brachioradialis with the flat part, and here I want to watch the thumb move. Here we're testing for cranial nerves. I'm going to do the bicep. We're going to want to watch the bicep react here. And then we're going to do the tricep. So use the flat part. Go ahead and relax. Okay. I'm going to use the other hand as well. Okay. Now the same thing. Relax your arm. Okay. And then we're going to do the tricep on this side as well. Relax your arm. I'm just going to have a pain. And then I'm also going to do your knees. If you can sit back just a little bit, I'm going to do your knees here. Okay, next we're going to do also the Achilles. Okay, the underfoot. Everything flex just a little bit. Support the foot. Okay, perfect. After that, we're going to go ahead and move down to the lower extremities. So I'm going to go ahead and just a little bit. We're going to assess the toes here. We're going to notice for any calf refill, less than 3 seconds, same as the hands. We can assess pulses here. So we're going to do a pedal pulse on both sides, which are strong, +2, and a tibial pulse, +2 on each side. Here, you're going to assess the joints, look for the skin color, any pain, tenderness, crepitus, swelling, nodules here. We're going to go ahead and test your range of motion again here. I'm going to have you curl your toes under and do flexion, keep them straight out, is extension, go up a little bit, actually keep your foot flat, and then you spring your toes up. Perfect. Is hyperextension, spread your toes out, is abduction, bring your toes in, is adduction. Great. Next, we're going to move towards the ankles. So I'm going to go ahead and help you feel for any pain, tenderness, look for symmetry, anything like that here. Everything is intact. And we're going to also do range of motion for ankles. So I'm going to do dorsiflexion. So go ahead, point your toes up. Same with the other foot. Point down is plantar flexion. Great. Bring your toes in. And we're going to do inversion, eversion, and go ahead and rotate and do circumduction. Great. Go ahead and stop. I'm going to assess the strength of your calves as well. So I'm going to go ahead and have you go ahead and flex down, push against. We're also test the strength of the ankle. So go ahead and bring your feet up like you did. Press on the gas. Great. Press up. Great. After that, we are going to do the vibration as well on Tom's feet before I move and have him lay down and complete the exam for the knees and the hips. So here we're going to, let me know if you feel, on the lateral malleolus.
Yes. Yes. No. Yes. Yes. No.
Okay, great. After that, we are going to go ahead and complete the exam, and you're going to go ahead and lay down for me, and we're going to finish assessing the knees and the hips at this time. So here we tenderness, swelling in his knees, any deformity, you're going to check bilaterally here, and then we can also move on to the hips. Notice for any deformities here. Okay, perfect. So we're going to do the range of motion of the hip first. So I'm going to go ahead and have your knees come up in a triangle. Perfect. And we're going to do flexion. So we're going to go ahead, this is flexion of the hip. You're going to bring your hips up a little bit. Extension, bring it up a little bit more. Hyperextension, go ahead and lay down. Thank you. Go ahead and bring your legs out. And we are going to do abduction and adduction. So we're going to go ahead and abduct. So you can support the hip if you can. So you're going to abduct and cross the midline and adduct towards the body. Here you can feel on the hip, you notice any cracking, crepitus, anything like that as well. After that, we're going to move to knee range of motion. So we are going to go ahead and put your feet up again. And we're going to actually put this leg down. We have to do one more test. We're going to do internal and external rotation of the hip. So we're going to internally rotate, externally rotate. Go ahead, lay down, and hit this way. We're going to internal, external, and down. Thank you. Then you can go ahead and bring your knees up. We're going to do flexion of the knee. So here we notice we're going to do pain or pauses. Next, go ahead, lay down your legs. We're going to look for extension. Go ahead, bring your legs up just a little bit. Flat, hyperextension. And here, we want to see a straight line with his knee, no bending, any abnormalities. They're both symmetrical here. Anything like that? No? Okay. Next, I'm going to have you go ahead and lay on your left side. Go ahead and bring your arm up for me. And we're going to just look at your spine. So here, we can lift up the shirt. We can palpate for any step-offs, any pain, any tenderness, swelling here. And here, there's no tenderness in the cervical, thoracic, or lumbar spine. Perfect. Okay, you can go ahead and sit up for me. And we're going to finish off our assessment. I'm going to have you go ahead and stand up for me. All right. We're also going to check the spine here as well. Make sure it is symmetrical. We're testing for any scoliosis. And we can also notice this while we do range of motion for the spine. Go ahead and flex forward to touch your toes. And here we want to see a straight line here. Notice any curvature or anything like that. So this would be flexion of the spine. Go ahead and stand up. We're going to do extension. So support their back, a little to the back. And then a little bit more is hyperextension. Go ahead and stand up. Next, we are going to test for lateral movement. So we're going to go ahead and bring your arms to your side and move side to side. And here we're noticing any pain too in this motion. And then you can go ahead and make some spinal twists for me. Perfect. Okay, you can go ahead and stop. Next test we're going to do is called the Romberg test. So we're just testing for balance. So I'm going to have you go ahead and bring your feet together. I want your hands on your shoulders and close your eyes. So here we'll notice any swaying. We're looking for any abnormal movements here because we're testing out his balance. So let's also there's any defects with the cerebellum. Okay, you can go ahead and stop. Next, I'm going to have you just go ahead and walk a couple feet back and forth, and this is come back. And we're just watching the gait. Notice any limping, any pain. Are you having any pain while you do that? No? Okay. And then next, I'm going to have you do tandem walking. So it's going to be one foot in front of the other. So you're going to go ahead and walk. You can come back. Perfect. Okay. Next, I'm going to have you go ahead and hop on one foot, please. So hop on the other foot, hop, and then hop on both. Okay, and then you can go ahead and stop. And then the exam is completed this time. And thank you for your time.